Hello everyone and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health section of Chronic Disease Prevention and Health Promotion. Our section's vision is for healthy and safe Alaskans, and our mission is to identify and advance conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. This webinar series was created to provide a forum where we as public health professionals can have an open dialogue around specific projects and explore ways to collaborate. We'll be offering webinars every third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore opportunities for further collaboration. Another way you can stay connected to our work is through our monthly newsletter. You can sign up for the newsletter on our section's website. Our website address is at the bottom of this slide. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep it on mute. Also, please do not put the call on hold. If you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of open dialogue. A recording of today's webinar and the slides will be sent to all participants. This will be made available within the week. Janice, can you hit next slide for me? Sorry, we're having some technical problems here, everybody. There we go. Audio for this webinar will come through your computer. Another option is to call the number provided when you registered for today's session. If you have technical difficulties, please let us know by using the question function in your GoToWebinar control panel as pictured here. You'll need a microphone on your computer to ask questions, or you'll need to call in the number provided to you for today, the number provided to you when you registered for today's questions. Please hold questions until the end of the presentation. To ask a question, please raise your hand by clicking on the hand button, as you can see in the panel next to or in the slide here, in the control panel in the GoToWebinar control panel. With that, I will let today's presenter introduce herself and today's topic.
Oh, Kelly, can you hear me?
Yeah.
Oh, good. Hi, I'm just making sure that I have control. So does that work for you guys? Are you seeing it change? Kelly?
Try advancing it once more, Janice.
Did it advance for you?
No. Let's
I'll
see.
advance it.
Just tell us when you need to change the slides and we can do it that way.
Okay. All right. Okay. So, okay. Hi. We'll just start at the very beginning. Hi, welcome and thanks for attending today. I'm Janice Gray, the nurse consultant for heart disease and stroke prevention in the section of chronic disease prevention and health promotion with the state of Alaska. I'm going to provide an overview of the Million Hearts Initiative and highlight some progress towards meeting the Million Hearts goals in Alaska. Okay, advance. Today, I'll review the Million Hearts recommendations for reducing the number of heart attacks and strokes, introduce proposed updates for the second iteration of Million Hearts, review national and Alaskan progress to date, and provide an overview of the state of Alaska partner projects focusing on the Million Hearts goals. Next. I'll start with a brief overview of the Million Hearts Initiative that was created to help focus efforts to decrease the number of heart attacks and strokes in the United States. Next. Million Hearts is a 5-year initiative launched in 2012 to prevent 1 million heart attacks and strokes by 2017. Hundreds of public and private sector partners signed on to focus their efforts to reduce the number of people who need treatment and to improve care for those who need it. Next. Million Hearts focuses on these 4 targets. You're going to need to advance. Aspirin when appropriate, blood pressure control, cholesterol management, and smoking cessation, which are known as the ABCs. Next. These are the original targets for the Million Hearts ABCs. This shows the need for focusing on the ABCs. For example, only half the people with hypertension had their blood pressure controlled when this started in 2009. Only 1/3 of people with high cholesterol had it controlled, and 22% of people who were trying to quit smoking got the help that they needed. To achieve the goal of preventing 1 million heart attacks and strokes, Million Hearts set a 65% population-wide goal for each of the ABCs. These goals include people who do not have a health or usual source of care and a healthcare provider. To reach the 65% population-wide goal, it was important for clinical systems to reach a 70% target. Next. This is where we stand meeting the ABC's goals nationally as of 2016. Aspirin use has exceeded the 2017 goal. Blood pressure control and cholesterol management have both improved, but have not met the 65% goal. Smoking cessation has improved dramatically, but has not yet met the 65% goal, but it's close. Next. National Million Hearts accomplishments there's many, but I'll just highlight a few here. They have fewer cigarette smokers. They've worked with food industry to reduce sodium, and the partners have worked with the FDA to eliminate artificial trans fat in the food supply. Next. This table gives you an idea of the number and variety of data reporting sources who are aligning their performance measures to assess the status of the ABCs nationally. The highlighted data sources are the ones the state of Alaska is currently using to track our work. At the beginning of the Million Hearts project, they nationally were not able to assess where we were because there were no good measures that all matched each other nationally. So during these past 5 years, they have been aligning these measures. Next. The next phase of Million Hearts is set to launch between January and July 2017. The 2.0 draft design continued to focus on blood pressure, including sodium intake, smoking and cholesterol, and a decreased but continued inclusion of aspirin for secondary cardiovascular disease prevention. The only new focus being considered was reducing particulate matter in the air. After these were reduced, after the initial draft was released, some of the feedback included the following: keep blood pressure, cholesterol, smoking, and sodium reduction is the central focus. Aspirin is less of a focus. And then consider particulate matter and air quality as a measure, and some aspect of nutrition, physical activity, and obesity, and also emphasize the disparities in risk in the 45 to 64-year-olds. The final Million Hearts 2.0 design should be released within the next few months, and like I said earlier, it should be out before July of this year. Next. The following slides review some data measuring the status of the ABCs in Alaska. Next. This graph shows the percent of patients in federally qualified health centers with ischemic vascular disease who are on aspirin therapy in 2015. And that's the measure. They have to have ischemic vascular disease to be on aspirin therapy. More than half of the FQHCs meet or exceed the Million Hearts goal of 70%. Next. Hypertension is a problem or a potential problem for everyone, regardless of age, race, or gender. However, you can see the huge challenge that the Black population faces with hypertension in the U.S. and Alaska and Alaska Natives in Alaska. The mortality rate depicted is for deaths where hypertension was a primary or contributing cause of death. Next. This graph shows the percent of patients in FQHCs with their high blood pressure in control. In 2015, only 5 of the 29 FQHC sites met the Million Hearts goal of 70%. So this is definitely an opportunity for improvement. Next. This graph shows the percent of adults in FQHCs who are screened for tobacco use and are receiving cessation intervention in 2015. A little over half of the FQHCs meet or exceed the Million Hearts goal of 70%. Next. The next few slides will provide an overview of some of the State of Alaska partner projects focusing on the Million Hearts goals. Next. Million Hearts had several strategies that they recommended to meet the Million Hearts goals. One recommended strategy was creating a hypertension quality improvement collaborative. Aligning with this, the State of Alaska partnered with the Alaska Primary Care Association, or APCA, to work on a quality improvement project with the federally qualified health centers. Another Million Hearts recommended strategy was to focus on team-based care. With the FQHC QI project, APCA also did training and provided resources to help the FQHCs receive patient-centered medical home certification. Another team-based care project is partnering with the Alaska Pharmacist Association to provide medication therapy training for Alaska pharmacists. And the Alaska Tobacco and Control Program partners with hospitals, many FQHCs that include community health centers and tribal health organizations to ask, advise, refer for smoking cessation programs such as the Alaska Tobacco Quit Line or an internal tobacco cessation program. And for emphasis on finding undiagnosed hypertensives, the State of Alaska is again partnering with APCA as they create a clinical data warehouse from which the FQHCs can run algorithms on their clinical data to find patients who meet the criteria for having high blood pressure but have not been diagnosed. The next few slides gives a little more detail for these projects. Next. The FQHC Quality Improvement Facilitator Coaching Project with the Alaska Primary Care Association consists of hiring healthcare practice quality improvement facilitators, that's a really long title, to provide on-site coaching for the staff members in the FQHCs to improve the care of patients with high blood pressure and diabetes. This project models its QI processes from the Institute for Healthcare Improvement, using the Model for Improvement as the framework to guide the improvement work. The coaching includes how to use these QI processes and electronic health record data evaluation, and offers evidence-based resources on how to improve blood pressure control in the clinics. The APCA staff also provides training for team-based coordinated care and patient-centered medical home certification when possible. Next. These are the locations of the clinics in the first cohort, or the first group of clinics that started during the first year of the project. And the work with these clinics has continued through today. Next. These are locations of the clinics in the second cohort that started their work in October 2016. So they're just beginning. Next. The second project focusing on team-based care is the partnership with the Alaska Pharmacist Association. The Alaska Pharmacist Association is providing American Pharmacist Association diabetes certificate training and cardiovascular disease risk management certificate training programs. These are both 2 to 3 day programs that are provided in person and as self-studies. ACFA also surveys Alaska pharmacists to evaluate their care of the patient with diabetes and/or hypertension. And ACFA is establishing an American Pharmacist Association Academy of Student Pharmacists with an Operation Diabetes and Operation Heart partnership with the new University of Alaska Anchorage, Idaho State University College of Pharmacy, then develop and implement the APHA ASP program. And this is the first time Alaska has had a pharmacy school in the history of the state. Next. Another project focusing on team-based care is the partnership between the Alaska Prevention and Control Program and hospitals, FQHCs, and their clinic grantees throughout the state. These partnerships focus on implementing the Ask, Advise, and Refer Brief Tobacco Intervention Program, and I have it outlined at the bottom of the slide. 6 public health regions in the state are partnering with Alaska's Tobacco Prevention and Control Program to reduce tobacco use and promote cessation by providing financial and staff support through their community-based prevention grant program. They are also assisting in customizing electronic health record systems to screen for tobacco use, advise quitting, and referring patients to tobacco cessation programs. This allowed for faster, nearly automatic referrals to counselors. Next. Another potential outcome of this program is the creation of a statewide system to screen and refer to local and statewide cessation resources within the tribal health system electronic health record. Next. The Alaska Tobacco and Control Program partners include these FQHCs, tribal health organizations, community health centers, clinics, and hospitals listed, as well as others in the state. Next. In order to find patients who have undiagnosed hypertension, the Heart Disease and Stroke Prevention Program again partnered with the Alaska Primary Care Association. APCA received a federal grant to create an HCCN data warehouse, which will store FQHC clinical data. This work started with the clinics in July of 2016, and it's a 3-year grant that they have secured for this project. They've identified 10 FQHCs to participate in populating this database. The Information Technology Data Warehouse Contractor will create electronic health record clinical reports for the FQHCs so they can follow patients with high blood pressure, diabetes, and other diagnoses. The reports will also track patients' tobacco use and referral and other screenings. These reports can be modified and saved by the FQHCs to meet their needs. A separate report will be created to identify patients with undiagnosed high blood pressure using an algorithm that will sort the patients in the clinic to be able to create a list of patients with undiagnosed hypertension. The IT contractor will also provide technical assistance to help the clinics redesign their workflow if needed to make this process work more smoothly. Next. If you would like any more details on any of these programs, please contact me or any of the people listed here. These are contacts for all of the different projects I talked about. Next. The next few slides include resources that you might find helpful. Next. These are resources within the state of Alaska, and this is only a small summary of the many that are out there. Next. These are national resources that are available for everyone. And next. And these are a list of the Million Hearts resources, and most of these are on the Million Hearts website itself. And next. And this is winter in Juneau, but not today. Thank you for joining us today. Does anyone have questions?
Janice, I think that probably people are writing their questions in as we speak. I have a quick question for you. I just noticed way back at the beginning the recommendation to decrease particulates
Yes.
do you know very much about that as far as why that's a problem, the particulates?
Well, the problem is air pollution, and when they did the draft, they weren't very specific in exactly how they were looking to reduce that or what measures they were using to measure that. When they gave the introduction to Million Hearts 2.0, they were very short on particulars. So, not
okay, thank you.
Particulars and particulate matter. But when they sent out the draft and came back with the additions of some kind of a dietary obesity focus and disparities focus, I think they're rewriting the actual rollout. So we'll find out more when they do the launch in the next few months.
Great, thank you. And just a reminder to everybody, we've got just a reminder on how you can ask a question. You can either type it into the question box or raise your hand and we will unmute you. So I've not seen any at the moment. We'll hang out for a couple more minutes or for a short time longer. Is there anything else, Janice, that you'd like to expand upon? We cut it short so people would have time for questions, but we don't have anybody writing in right now.
I just a shout out to the partners who have done just amazing work, working with the FQHCs and working with the tribal organizations to advance the help with the decrease of chronic disease. So I guess that's my biggest takeaway is the amount of work the partners have done.
That's great. Well, I am not seeing any other questions, so I think we can go ahead and end the webinar. Again, a recording will be sent out. It'll go to everybody who registered for today's session, so you'll have a copy or you'll have a link to a copy of today's presentation and the PowerPoint so you can look at those resources. And you can always get on our website and shoot a question to us if you have any further. Thank you very much, Janice.
Thank you. Bye-bye.